Welcome to the Scenario Podcast, your guide to mental health and well-being. Each episode, we uncover practical tools, discuss expert insights, and explore how supplements can transform your mental health journey. Get ready to learn, grow, and thrive with us.
Welcome to the deep dive.
Yeah.
If you've ever been maybe just sitting there reading an email or stuck in traffic and bam, this crushing tightness hits your chest.
Yeah.
That moment where your mind just leaps to the worst possible conclusion.
Absolutely terrifying.
Then this deep dive is definitely for you. We're digging into the research on stress-induced chest pain. It's, incredibly common and so often mistaken for a cardiac emergency.
It really is a crucial topic because that fear, it often just makes the pain worse, creates this awful feedback loop of anxiety.
Right.
So our mission today really is to cut through that panic. We want to give you the clearest possible path to understanding what this pain is, how you can tell it apart from something more serious.
And what you can actually do about it, both right now and, well, for the long haul.
Exactly. Actionable steps.
Because the fear is real.
Mm-hmm.
I mean, the sensation feels real. It's not just something you're imagining.
No, absolutely not.
So our goal here is to arm you with the knowledge, give you a sort of blueprint for action, not panic when it happens.
Yeah.
Let's start with the basics. What is this stress pain? Why does it even happen?
Okay. So the research generally describes stress-induced chest pain as typically sharp. Sometimes it feels like burning. But the key thing is it's localized.
Localized, meaning it stays in one spot.
Pretty much, yeah. It tends to flare up right when mental or emotional tension spikes. That specific location, that kind of focused feeling, that's usually your first big clue.
Okay, localized, I get that. But why? Why does feeling stressed out mentally translate into actual physical pain right there in the chest?
Well, it's kind of fascinating, isn't it? It's basically your ancient biology colliding with, I don't know, your modern work deadline.
Right.
Stress triggers the fight or flight response. That system's designed to help you escape a predator, not finish a quarterly report.
So it's our caveman brain freaking out over a spreadsheet instead of a saber-toothed tiger.
Exactly. And when that system kicks in, it floods your body with adrenaline and cortisol. Okay.
And that chemical surge does a few things. Your heart speeds up, obviously.
Yeah.
But maybe most relevant here, your muscles tense up involuntarily, including the muscles around your ribs, even your esophagus sometimes. That tightness, that pressure, that squeezing feeling, often that's literally your muscles contracting.
Whoa.
And it gets compounded by that shallow, rapid breathing people do when anxious, which makes the chest feel even more restricted.
Okay, so if that's what happens during one really stressful event, what about when stress is just constant, when you're living in that state all the time?
Yeah, that's where it gets tricky. Chronic, unmanaged stress definitely makes these episodes happen more often, and they can feel more intense too.
Makes sense.
And if you look at the bigger picture, the long-term cost is pretty significant. Constantly high levels of cortisol and adrenaline, they're just not good for your cardiovascular system. It increases your baseline risk for things like hypertension and, down the line, even heart disease.
So getting a handle on this isn't just about feeling better now, it's actually preventative health. It really is genuinely preventative health care.
That definitely raises the stakes. Okay, so once we understand why it's happening, the really critical question, the one everyone wants answered, is how do you know the difference?
Right.
If you're doubled over, feeling that pain, how do you figure out if it's anxiety-related muscle tension or something that needs an immediate 911 call? Nailing this distinction is probably the most important part of this whole deep dive.
Absolutely. And let me preface this by saying, if you are ever in doubt, you need to seek medical help immediately. Don't hesitate.
Crucial point, yes.
But, for awareness, for maybe a little peace of mind, the research highlights 3 key differentiators we compared.
Okay, let's break them down. First one, location. Where does the pain actually show up in each case?
Okay, the key word here is movement, or lack thereof. Anxiety-related chest pain. It tends to be localized, like we said. Maybe sharp, maybe stabbing, but it stays put.
Stays put.
Okay. Cardiac pain, or angina, is often described as radiating. It spreads, it moves outwards, typically to places like the left arm, sometimes the back, the neck, or even the jaw.
Ah, that's a big one.
That radiating spread, that's a serious red flag.
So, like a sharp pinpoint pain near your breastbone that doesn't go anywhere, that leans towards stress. But if it feels like it's creeping up towards your jaw...
That's a much more concerning sign, potentially cardiac, yes.
Okay. What about the trigger? What sets it off?
Stress pain is almost always linked to an emotional spike. A panic attack, a sudden wave of anxiety, maybe a really stressful moment.
Right.
Heart attacks, well, they can happen at rest, but often they're triggered by physical exertion.
Okay.
So if you feel severe pain right after, say, sprinting up 3 flights of stairs, that points towards a different cause than pain that hits you suddenly while you're watching a tense movie.
That makes sense. Different mechanism.
Mm-hmm.
Okay, and the third one. The sensation itself, what does the pain actually feel like? How is it different?
Stress pain is often described as tightness, pressure, maybe a dull ache. It's that muscle tension we talked about.
Right, the muscles contracting.
Cardiac pain, on the other hand, is almost universally described as severe pressure, crushing, squeezing, sometimes a heavy fullness.
The classic elephant on the chest.
Exactly that analogy.
Yeah.
That quality of severe, suffocating pressure is a distinction you really, really need to pay attention to.
Okay, that comparison is incredibly helpful.
Mm.
Localized sharpness versus radiating, crushing pressure.
Yeah.
But we absolutely have to repeat that crucial warning found in all the research.
We do, absolutely. This information is for awareness. It helps you understand your body, but it is not a substitute for diagnosis.
Definitely not.
If you experience any chest pain that feels new or severe, or it just won't go away persistent, you must get it checked out medically right away. Rule out the serious stuff first.
Use this info to understand, not to delay help.
Got it.
Okay, so let's say you've used these differentiators, you've assessed things, and you're feeling reasonably confident it's likely anxiety-related pain. What's next? Immediate relief. When that sharp, localized tension hits, what's the practical toolkit? What can you do right then and there?
The fastest way to signal safe to your body is through your breath. Hands down, the most recommended technique is diaphragmatic breathing, sometimes called belly breathing.
Belly breathing, okay.
Think about it. Shallow, rapid chest breathing is part of the panic response, right?
Yeah.
So consciously using your diaphragm actually breaks that cycle.
Can you walk us through how to do it? I feel like people hear, just breathe, but rush it when they're actually panicked.
Yeah. You need to be deliberate. It helps to sit or lie down comfortably. Put one hand on your upper chest, the other on your abdomen, just below your ribs.
Okay, hands in place.
Now inhale slowly through your nose. Maybe count to 4. And the goal is to make the hand on your abdomen rise much more than the hand on your chest. Feel the belly expand.
So breathing down into the belly, not up into the chest.
Exactly. Then exhale slowly through your mouth, maybe for a longer count, like 6. That slow, controlled exhale is key. It actually activates the part of your nervous system that tells your body, okay, you can relax now.
That focused effort literally forces a physical shift.
The sources also mention pairing that breathing with mindfulness or grounding techniques.
Yes, they work really well together. Breathing calms the body, grounding calms the mind.
How so?
Well, when anxiety hits, your mind tends to race ahead, worrying about the future, or it gets stuck ruminating on the past, right?
Totally.
Grounding exercises yank your attention right back to the present moment, to what's actually happening around you through your senses.
Oh.
It sort of short-circuits that panic loop.
Makes sense in theory, but when you're mid-panic, how do you actually force your brain to switch gears like that? Is there a trick?
The trick is structure, forcing your focus. The 5 senses technique is great because it's procedural. You don't have to think too hard.
5 senses. Okay. How does that work? You just stop and ideally name them out loud. Find 5 things you can see right now. Then 4 things you can touch. Feel the texture of your clothes, the cool surface of a table.
Okay.
Then 3 things you can hear, 2 things you can smell, and finally 1 thing you can taste, even if it's just the lingering taste in your mouth.
Ah, I see. By forcing your brain to focus on sensory input.
You disrupt those runaway anxious thoughts that are causing the physical tension. It pulls you out of your head and into the physical world.
That's a powerful combo. Structured breathing and sensory grounding.
Yeah.
Great tools for that moment of crisis.
Yeah.
But like we said earlier, that's immediate relief. Symptom management. For the long term, we need to look at lifestyle, right?
Correct. If this chest pain keeps happening, the goal has to be reducing how often that fight or flight system gets triggered in the first place. And the research gets pretty specific here. It's not just generic eat well, sleep more.
Right.
Understanding how those changes reduce physiological stress is key.
Okay, give us those specifics. How do lifestyle changes actually help manage this specific pain?
Okay, take exercise. Regular physical activity, and it doesn't have to be intense. Even 30 minutes of brisk walking it's proven to help your body metabolize those excess stress hormones, like cortisol and adrenaline.
So it literally burns off the stress chemicals.
Pretty much. It acts like a pressure release valve for the very chemicals causing that muscle tension in your chest.
Interesting.
And conversely, cutting back on certain stimulants is also really important. The research clearly links things like caffeine and nicotine to increased heart rate and muscle tension.
Ah, so they mimic the stress response.
They can, yes. They directly worsen the physical sensations of chest tightness for some people. So if you're prone to anxiety, even just cutting back a bit on caffeine might lead to a noticeable drop in how intense these episodes feel.
Okay, so move more to flesh out the stress chemicals, limit the stimulants that add fuel to the fire. Makes sense.
Exactly. And then there's the whole cognitive piece. Lifestyle changes support the body, but what about changing the thoughts that trigger the whole stress response to begin with?
And that's where things like cognitive behavioral therapy, CBT, come in. Sounds like a really powerful long-term strategy.
Oh, it's exceptionally effective for this. CBT basically teaches you to identify those specific negative thought patterns, those distortions that lead straight to anxiety.
Like automatically jumping to the worst-case scenario.
Exactly. That automatic, catastrophic thinking, this tightness must be a heart attack. CBT helps you catch those thoughts, challenge them, and reframe them more realistically.
So you're changing the input, the thought that tells your brain to hit the panic button.
You are literally changing the input, and the result is less anxiety overall, and therefore fewer physical symptoms like that chest pain.
That clarity on the thought process itself feels huge.
Yeah.
It's not just coping with the pain, it's actually addressing the root cause of the stress signal.
Right. And, we should definitely mention, for anxiety that's chronic or really severe, the kind that repeatedly triggers these painful episodes, talking to a healthcare provider is essential.
Good point.
Sometimes professional therapy, maybe even medication, is needed to kind of build that foundation for long-term emotional and physical stability.
This has been incredibly insightful, really clarifying a very distressing experience for a lot of people. So you now have that knowledge to help distinguish between that localized, sharp, stress-triggered pain and the more concerning, radiating, squeezing, pressure-based cardiac pain. And you've got a full strategy. Immediate relief through that slow belly breathing and grounding.
Right.
Combined with those powerful long-term changes like exercise to burn off stress hormones and maybe exploring CBT to rewire the thought patterns driving the tension.
And if we just zoom out for a second, what's really fascinating here is we've established the physical reaction to stress is real, it's measurable, it causes actual muscle tension and pain.
Yeah.
But then you look at the power of therapies like CBT to fundamentally change how the brain reacts just to a thought. It makes you wonder, how much control could we potentially have over these deep physiological responses just by getting better at managing our own minds?
That's a powerful idea.
That really suggests that line between mental well-being and physical symptoms is maybe a lot blurrier than we usually think, and that connection, that's definitely worth exploring further.
That thought alone offers a path towards some real relief. Thank you for joining us on this deep dive. We really hope this knowledge brings you some confidence and maybe a bit more calm the next time that pressure hits.
Thanks for tuning in to the Scenario Podcast. Don't forget to visit scenario.com for more expert tips, articles, and supplements designed to support your mental health. If you enjoyed this episode, remember to subscribe and share it with a friend. Until next time, take care of yourself.